afternoon, ladies and gentlemen. I am calling the St. Louis County Council Committee of the Whole to order. May 11, 2021, 2 p.m. We are going to be discussing this afternoon the Older Adult Commission 2020 Annual Report. Madam Clerk, will you please call the roll?
Yes, ma'am. Councilmember Days.
Here.
Councilmember Dunaway. Councilmember Fitch.
Here.
Councilmember Webb. Councilmember Clancy.
Here.
Councilmember Tracus.
Present.
Councilmember Harder. Madam Chair, you have a quorum.
Thank you very much. And Councilwoman Webb did call and let me know that she is in a meeting this afternoon and will not be able to attend. The committee takes official notice of and it admits into evidence all St. Louis County ordinances and resolutions. We are here this afternoon to discuss the Older Adult Commission's annual report. We know that the senior community has had many challenges this past year, as many of us had, and so it's going to be very interesting to me how we have handled that and what some of the challenges other challenges that they faced as well. So with that, we have a couple of panelists with us this afternoon, Liz and Zalima. Which wants to go first, or how do you want to do this?
Thanks, Rita. I'll go first as the chair. Right. Okay, thank you. Good afternoon. I'm Liz DeLaperouse, Chair of the St. Louis County Older Adult Commission. Thank you for giving us this opportunity to present. The St. Louis Older Adult Commission was very busy last year. And fortunately, the commission only has 2 vacant positions. Before I give an overview, please allow me to introduce the members of the St. Louis County Adult Commission. And you can't see them, so I thought they might be on the screen. So I'll just, Wayne Fleisch, he has worked for St. Louis County and East West Gateway Council of Governments. He was wonderful at keeping us informed on progress with the census and transportation issues concerning older residents. Lisa Hotley. Lisa was the first chair of this commission and has a doctorate in health education. Carol Rodriguez. She's a retired senior vice president of public policy for the Alzheimer's Association of Greater Missouri Chapter and vice chair of this commission. Dan Rosenthal is an architect who has designed and built senior housing developments locally and nationally. Lisa Knowles is director of Aging Ahead, one of the 10 Missouri Area Agency on Aging, AAAs, an invaluable resource for the commission. Deborah Grandison, a longtime survivor of both heart disease and diabetes. Deborah believes art and creativity are vital to keep seniors active and engaged. Then, of course, Zulema Martinez, retired UMSL biology professor who has volunteered for years with the Alzheimer's Association, focused on public policy and Latino community outreach. Commissioner Helen Castile has been a long-time advocate for older adults, and she is also a liaison to State Senator Jill Shoup. Finally, me. I am an advocate for science and public policy and for older adults aging in their homes and communities. The commission realized early that COVID-19 would impact older residents significantly. Knowing this, we voted to not recess during the summer of 2020 so that we could continue to get updates on how St. Louis older adults were managing and pass these on to the county executive. The details of what the commission did throughout the year is included in our annual report. Commission member Lisa Knoll informed us about how her agency implemented its emergency plan, closing all senior centers and adding to their home delivered meals, toiletries, and PPE. As the pandemic continued, her staff added wellness calls to isolated older adults. County older residents programs also expanded its support for older adults, increasing wellness checks, providing pickup delivery of curbside orders, as well as pre-registering for the vaccine and then making vaccine appointments for older residents who did not have access to the internet or a computer. We also cannot say enough about the St. Louis County Libraries and what they were able to do for all residents of St. Louis County, young and old. Transportation has been an interesting challenge. With stay-at-home orders, many doctor's visits and other non-essential appointments were canceled. At the same time, volunteers could not provide rides. This issue will continue to evolve throughout 2021. The Commission identified 2 areas that were a problem for older adults that could be helped with additional funding. Lack of technology and access to the internet. What before had been inconvenient became a necessity for connecting with family and friends and telehealth. Home repairs so older adults were safe, secure, and comfortable in their homes. We were unable to fund either of these needs in 2020. Early 2021, funds became available and the need for technology was recognized. Aging Ahead had been giving some isolated older adults tablets, but found that they were difficult for older residents to understand. They'd been told about a device being offered called GrandPads that might be a better solution because they have been built with internet access and were specifically produced to be user-friendly even for those who have little experience with technology. Kristen Sorth, director of the St. Louis County Library System, looked into GrandPads and requested funding. Now, 1,500 homes have GrandPads, and St. Louis County is a model for connecting older, isolated adults to technology. The cost of this program is $1 million, and we hope that this continues and is expanded. The need to make sure older adults are safe and comfortable in their homes has been amplified during the health crisis, as older adults were forced to remain in their homes. St. Louis County has a program to assist with home repairs through the Office of Community Development. We would like to see that expanded to include small support like changing light bulbs and securing locks, and bigger repairs such as heating and cooling. The limit on repairs is $5,000 and can only happen once per household. Having a roof that does not leak and a home that is cool in the summer and warm in the winter would significantly help older adults remain in their homes. Changing a light bulb may seem trivial, but having an older adult climb a ladder is just not safe. 1,000 home repairs at $5,000 each would cost St. Louis County $5 million. Not all home repairs would be for $5,000, but the impact would be significant in making older residents safe and secure. Lastly, June 15th is World Elder Abuse and Exploitation Awareness Month. Last year, St. Louis County issued a proclamation on June 15th acknowledging elder abuse and exploitation as a huge problem and one that has only gotten worse with the pandemic. We hope that technology such as GrandPads could help address elder abuse and exploitation, while repairs to homes allow older adults greater safety. The Older Adult Commission is a volunteer group, and we could not have followed the challenges of this past year without the help of collaborating organizations committed to the well-being of our older adults. Our thanks to the St. Louis County Older Residents Program, St. Louis County Library, Aging Ahead, Jewish Federation, and the St. Louis City Senior Fund. And a special thanks from this commission to Susan Schaefers for all her help. She is with the St. Louis County Older Adult Programs. Again, details on all the commission's activities during 2020 are in our year-end report. Zuleima Martinez will now give some additional remarks.
Yes, I would like to start by thanking the St. Louis County Council and most especially Chairwoman Rita Days for her strong support for the work of the St. Louis Older Adult Commission. We are grateful for the interest and backing of our efforts to ensure that older adults in St. Louis County are able to weather the pandemic as best and as safely as can be hoped for. I would also like to reiterate a point made by Liz with regards to the importance of the funds that we are requesting to make smaller home repairs. That's the $5,000 expenses that she referred to. As Liz said, changing a light bulb might seem pretty trivial, and one could wonder why it would be necessary to have a repair person come into a house and do something as simple as changing a light bulb. And I do a story. We, and by we I mean my family, not the Older Adult Commission, have an acquaintance, an older adult, even though on the younger side of older adult, who got up on a ladder to do some work at her home. She fell off the ladder, severed her spinal cord, and is now a paraplegic. Another example of the type of minor home repairs and improvements, which could be very consequential, is the installing of grab bars for toilets and bathtubs. In my own case, even though I am very active and I do personal training and hike and do that sort of thing, on 2 occasions now, I have prevented falls when getting out of my bathtub precisely because we have grab bars installed in our bathroom. Without those grab bars, I could have fallen and broken a hip, or even worse, hit my head with more dire consequences. So even though the repairs are small and may seem trivial, they can be life-saving and can ensure the safety of older adults and of other people as well, actually. And in the end, this could save enormous amounts of money if the older adult, by avoiding an accident, is able to stay in their homes for a longer period of time. The last thing I would like to emphasize is what I see as 2 major strengths of the Older Adult Commission. The first is the amazing depth and variety of expertise that our commissioners have, and that we all work so well together as a team. When expert knowledge is needed in our commission, it seems that there is always 1 or more commissioners that are experts on that topic. Needless to say, this has greatly facilitated our work over the last few years. The second strength is the ability that we have shown to form partnerships, the partnerships that Liz already mentioned. And these are partnerships with other agencies and institutions in St. Louis that are already working with issues relevant to older adults, and also with adults with disabilities, so that the chair of the Commission for Adults with Disabilities is a regular attendee at our commission meetings and reports, because there is such an overlap between the 2 groups. We as a commission do not have a budget. We have no funding, and all of our members are volunteers. This means that for us, cooperating and collaborating with the other agencies has been a godsend, and we are very grateful to them. So with that, unless Liz wants to add anything else, I think we are ready to open the presentation up to questions. And I thank you all very much for your attention.
You are quite welcome, and thank you for your commitment to the older adults community. I'd like to see if any of my colleagues have any questions at this point. Any questions at all? Councilwoman Clancy?
Sure. Yeah, I just wanted to confirm what I think I heard, what I'm pretty sure I heard. Your two priorities that you shared with us are to expand funding for technology, specifically the GrandPads program.
Correct.
How much funding would you like to access?
Well, I think certainly to do the $1 million that that program started for this year, because the GrandPad devices are leased, and then there's a monthly fee. So just to maintain the 1,500 households that we've already got connected, we would need that $1 million again next year, for next year. I think that, it would be wonderful to grow that program, to see if we can't provide, another, and that would be entirely up to the county council if they want to do another 1,500 families or whatever I think maybe that would be a good thing for us to revisit when we've got some more data. GrandPads is collecting a lot of data with this program. As I said, it's a model that this is the first time that they've partnered with the library system. And this order was the biggest order they have ever had. So there's a real, use a word we like to use, collaboration between St. Louis County and the GrandPads organization. And they've been very good at tailoring these GrandPads to be specific to St. Louis County, adding phone numbers for vaccination, for instance, those kind of things. So, yes.
And then also the funding.
I'd be curious.
For the small repairs.
Oh, go ahead. Yeah.
No, she was just asking.
Yeah.
Okay.
Zelima,
Yeah.
I think
Well, before I go to,
It's okay. I'm going to let Liz talk about the other
repairs.
thing we're asking for is funding for the small home repairs and improvements.
Okay, well, let's
and
go
one
back
thing-
to Councilwoman Clancy and let her complete, because I think she had questions about the
Okay.
GrandPads, okay?
Okay,
yeah,
sure.
one more thing about the GrandPads. Do you all have the information of the 1,500 households by zip code? I'd be curious to see what parts of St. Louis County we're touching,
Yeah.
especially as there might be efforts to consider, broadband access and other things, which I know doesn't necessarily completely solve the challenges that older adults have because they still need user-friendly technology, but that would be interesting data to have, I think.
Yeah, Lisa, I would be happy to get that to you.
Great.
We have numbers on exactly, or rather the library had numbers of exactly who got those and where they lived and whether they were a single household, family household. So I can get all that data for you. Happy to send that to you.
That would be great. And I'm pleased to hear that this program has been successful and that you all were able to work closely with the library on this. I know, Liz, we talked a few times last year and it just seems like a good match for you all to be working with the library. So I'm glad to hear that happened. And then the second piece that I wanted to confirm, which it sounds like you're ready to say more about, is the piece about expanding funding for home repairs, even modest home repairs that are less than $5,000. So again, want to make sure that I heard that correctly as your second priority, and then also what kind of money are you talking about wanting?
Well, I think that's why I tried to kind of I don't know I mean, I think as much money as we can get to, I mean, we know the need is great. This is where actually our collaboration with the senior fund and the city has been helpful. So Jamie Upsall, they are funding that kind of a program in the city. And again, there's a needs base for this. So it is really only those homes where the owners just can't keep up with these minor repairs. That would be a one-time thing. I mean, once you've fixed the roof or fixed the locks or put the grab bars up, you're not going to have that as a reoccurring expense. But I do think it could be incredibly beneficial. And they have this program already going on in St. Louis County. I believe, and Susan Schaefer's is the one who knows this better than I do. I believe they're forgivable loans is the way it's set up right now. And the maximum is $5,000. And I understand there is a little flexibility in that. I mean, if they can go a little higher, if the need is recognized and really felt that it could be met. So I think, again, we could do, I just threw out the number of 1,000 people because just makes the numbers easy, but you could do 500 and do it a lot yet less. So if you did 1,000 families, it'd be $5 million.
Got it. Thank you. I do think some of our community development block grant money that gets dispersed to municipalities can be used for that purpose, but it has to be determined by the municipalities themselves. I'm not sure how much of it from St. Louis County's allocation of that gets used for that, but I get it. We need more. This is a really good time to be asking the council for things right now because we've got money to distribute soon from our ARP funding. So good timing. I will turn it over to anyone else I'll turn it over back to the chairwoman. Thank you.
Thank you. Councilman Fitch.
Thank you, Madam Chair. Just two questions. Last year I asked about legal services for older adults in St. Louis County. And we had heard there had been some cutbacks in that, and you all were looking to the Bar Association to pick up some of that work. Can you give us an update on what's going on as far as legal services to older adults?
Okay, I am not too sure about, I know that because of the elder abuse and exploitation, that task force of which I am a member, that we're closely working with the Federal Reserve and the prosecuting attorney's offices. And so I know they have been providing services, but I do not think, I mean, with the pandemic, I think a lot of that was really put on hold. So I don't know if Susan Schaefer's, I know, might have an idea about what services. I know they're still providing tax services for older residents, but I don't know about legal services, wills, and those kind of things.
Okay, all right. And then my second one is I received an email this afternoon from a local fire chief who asked me about elderly homebound, who've been trying to get vaccinations for more than 3 weeks now. Are you all involved at all in advocating for those individuals?
Absolutely, we are. Very much so. I've actually referred people directly. I would have that fire chief contact Susan Schaefer's County Older Residents Program. She can help with them. And I believe that Aging Ahead was going, there was going to be, they were going to homebound individuals to give them the vaccination. And I think it might have even been some of the fire departments that were being given the ability to go do that. So
yeah,
I
this
would
was
call
actually
Susan.
The Crestwood fire chief was the one that sent me the email saying that they haven't been able to get through on the line, and he's got these individuals asking about shots for the homebound. I just didn't know if you all were involved in that at all.
Yeah, we just refer them to Susan, and she's been fantastic at making sure those individuals are getting their shots.
All right. And one last thing, just to follow up on the small home repairs or the small repairs in the home. Who would you see actually doing that work? If the money's allocated, who would physically take that money, make sure the people that were available to go out and do those light bulb changes and, you know, change out a toilet ring or whatever it might be, those small home repairs, who would you envision doing the actual work of managing that?
I believe there are approved contractors that St. Louis County uses to do those services.
So you would see St. Louis County being kind of the lead to take in those requests for small home repairs and then actually dispatch the people to do the work and then make sure they get paid. Did I hear that right?
I believe so.
Okay.
Yes.
I just wanted to know what you thought the process would be.
Yeah, because we as a commission do not have the ability or the resources to do any vetting of individual contractors. And so I think it would have to be the county essentially. And like Liz said, it's already being done to some extent. So the system is set up. It's a matter of expanding it.
And in the city, where they do have funding, because seniors count passed in the city, the seniors fund uses other aging networks to help perform a lot of those jobs. Some of it is volunteer work. I know with the Jewish Federation, changing the light bulbs and lots and things like that, that's something that's done within their NORC as a volunteer. I believe it might be the same with the village.
Okay. Thank you, Madam Chair.
Thank you. And thank you very much for your presentation. I wanted to go and talk a little bit more about the vaccines. I know that this community, our community, was the first supposed to be in line to get those. Have you met with any challenges or people not being able to get to receive their vaccines? Any challenges of those sorts because of transportation or what other? I know we mentioned the homebound, but any others who might just not have the transportation to get there?
Could I ask that if possible, if Lisa Knoll is on this call, if she could be given the right to respond, the ability to respond to that, because I think she would be best equipped to help. And if not, maybe Susan Schaefer's could help.
Madam Chair, Susan Schaefer's is showing on here. What, the Lisa Nolan?
No.
Okay.
K-N-O-L-L-S.
But I can move up Susan if you'd like.
Could you please move up Susan? I'd appreciate that.
Doing it right now.
Okay, can you hear me?
Susan, are you
Yes,
there?
we can.
Yes, I'm here.
Okay.
So the answer, the Aging Ahead has been providing transportation for people who are facing challenges with that, older people who are facing challenges, and they have been able to meet the needs of everyone that has contacted them. So if we get in contact with someone, when we were making appointments for people, if they had a challenge with transportation, we immediately referred them to Aging Ahead, who got them to their appointments. I'm not aware of anybody who needs a vaccine who's not been able to get one, with the exception of some of the homebound people. And those are kind of more dependent on the fire departments and the paramedics who are doing those. So there may be a backlog. I can't address that because I'm not sure. But I know people are getting them definitely for sure. But I think for the most part, the older adults who are interested in getting it are probably able to get it at this point. We've not talked to anyone, and I get calls pretty regularly from people now who want to know how to get the vaccine or where should I go or how to do it. And so I just walk them through the process, and I'm even able to set up appointments for people at some of the locations. So or what I do is use the county website and register them that way. So I think at this moment, if you know people who are not able to access it and you want to refer them to me, that'd be great. And I'll help walk them through it.
So Susan, your catchment area is totally St. Louis County, is that correct?
Right, the whole county.
Okay, and how do they know, how do they get in touch with you if there is a challenge? Do you have some kind of literature that you send to all seniors, or how does that happen?
No, I really honestly, I don't know how people get my name and phone number, but I get calls from people all the time that I have had no previous contact with, and I don't think they've ever been aware of the county older resident programs, but somehow they're getting my name and number. All I can assume is it's word of mouth. Plus, the Department of Public Health has been very good at referring people to me if they're older and they just need a little bit more help accessing the vaccine.
Well, that's good to hear, but I do also know that particularly in my community, sometimes we're getting better about that, but the access for computers and online information is not always there. It's not always accessible, and we don't always know how to use that. So, getting that information out to people other than go to the website, has always been a concern of mine. I don't think the other thing that you mentioned was, I guess, and that went along with the grandpads, and that was telehealth. So I'm interested again in the zip codes that utilize the grandpads and to see if we can possibly get some more. How were the 1,500 families that you currently that have the grandpads? How were they decided? How did you decide on who got them?
That was really done by the library, and they targeted people over 75, though I think that anybody over 60 could consider it. Those that were lower income, those that did not have any internet, or what internet they had, they couldn't take advantage of it because they didn't have a device that they were comfortable using. Mm-hmm. And that they were homebound, not in congregate living situations. When we were looking over the funding that had been given to technology, which was what we were kind of tasked with last May when we met with all of you, we noticed that a lot of for instance, Lutheran Family Services got money for technology, but they were giving that technology to primarily people who were in residential facilities. That's when we decided that the hole that was not being met were older adults living alone in their homes in areas with very little internet that needed to have that service. So that's why and our initial ask of the county executive was only for 300 devices, because at that time we had heard from Lisa Knoll how difficult it was to make sure that the devices were actually useful to those older adults. That's why when we found out about grandpads, the library was fantastic at recognizing that they could give these to a lot more families. They know how to distribute items to families. And they also are going to be using those library facilities to provide book clubs, all sorts of things using these grandpads. So as the year goes by, we will be collecting data on things like telehealth. Are these really helpful or not? And we'd be happy to send you whatever information we get on that as we get it.
Thank you. For the information, I don't know, you can just send it to Diane and she can disperse it, because I'm interested in the same information that Lisa, Councilwoman Clancy asked. So just send it to her and then she'll disseminate it to the rest of us. Okay?
Perfect.
Any other questions? Any other questions from from committee members? Council members? Councilman Fitch?
Just a comment to Ms. Schaefer's. I did forward you that email from the Crestwood Police Chief, Fire Chief rather, to your county email. So you have that about the homebound needing vaccination.
Okay, I'll reach
Okay.
out to them today.
Thank you.
All right. Anyone else? Anyone else? Okay, do you all have any last comments you want to make?
Just thank you so much for your time and thank you for all that you do for our community, to everyone on the council.
You're quite welcome. At this particular, I'm sorry?
No, I just want to say I second that. We are extremely grateful for the support.
You're quite welcome. At this point, Diane, do we have any public comments?
No, ma'am.
All right. Any last words from the council? All right. Seeing none, I would entertain a motion to adjourn.
So moved.
Is there a second?
Second.
All right. All in favor, please say aye.
Aye.
Those opposed, no. Motion carries. We are adjourned. And thank you, ladies.
Thank you.
Thank you.
Thank
Thank you
you.
very much.